خب سلام به همه. میخوایم قسمت بعدی کتاب بخونیم از When We Do Harm Chapter 1 Jumbo Jet Crashing. در واقع این قسمت دوم فایل میشه. In the summer of 1846, a young Hungarian doctor named Ignaz Semmelweis was appointed to be the equivalent of the chief resident of the obstetrical service at Vienna General Hospital. The hospital had two maternity wards that were called in typically utilitarian medical terminology the first clinic and the second clinic. The destitute of Vienna came to these clinics to deliver their babies because the medical care was free. The flip side of the deal was that these patients were part of a teaching service attended to by trainees who were supervised by more senior staff. The first clinic was the training site for medical students and the second clinic was the training site for midwives. خب اینم که از کتابای قبلی که با هم دیگه خوندیم، اگه یادتون باشه گفتیم که توی اون دوره و سالهای در واقع قرن 19 ما نظام آموزش پزشکیمون خیلی به بیمارستان ها راه نداشت و بیمارستان تخصصی و اینا نداشتیم و این در واقع توی وین، توی فرانسه و خلاصه توی اروپا برای اولین بار داشتش بیمارستان های تخصصی که رزیدنتی داشتش که آموزش ببینه یا حالا میدوایفی داشت که آموزش ببینه شکل میگیره. For simplicity of scheduling, the two clinics altered their admitting days. But Dr. Semmelweis quickly learned that patients vastly preferred the second clinic, یعنی همون کلینیکی که میدوایف هستن, and that they would do almost anything to be admitted to the second clinic over the first clinic. The reputation of the first clinic was that it was the place where you went to die. But it wasn't just reputation that made the first clinic so undesirable. There were data to back this up. Puerperal fever, also known as childbed fever, was a rampant killer of otherwise healthy mothers at the time. The mortality rate in the first clinic was vastly higher than in the second clinic, sometimes tenfold higher. Patients begged, wept, and pleaded to gain admittance to the second clinic. There were stories of women opting to give birth on the street rather than take their chance in the first clinic. As chief resident, Semmelweis was determined to figure out the reason for the striking difference in mortality rates. Because the ward admitted on alternate days, the patients were randomly distributed, at least in theory. In practice, though, the second clinic housed many more patients because women did everything possible to get themselves admitted there. Even with that increased workload, mortality was still lower in the second clinic. Semmelweis examined every characteristic he could think of that might explain the mortality difference between the two clinics, including breastfeeding rates, religious observance, ventilation, and weather. In the end, he could find no difference between the clinics other than the obvious fact that one was staffed by the medical students and the other by midwifery students. اینجا رو هایلایت کنم. چقدر این بده. What were the midwives doing differently than the doctors? It turned out to be nothing, at least nothing related to how they care for their patients on the maternity ward. The childbirth techniques were identical. It was what they did on the way to the ward that was different. The medical students spent their mornings doing autopsies. The midwives did not. عجب. وای چقدر جالب. گفته که تنها تفاوت این بوده که برنامه در واقع کاریشون فرق داشته و مدیکال استودنت ها قبل اینکه بیان در واقع برای دلیوری میرفتن و اتوپسی انجام میدادن. The The clincher for Semmelweis came with the unfortunate death of one of his colleagues. The physician fell ill after being pricked by a scalpel wielded by a medical student, no less, during an autopsy and died shortly thereafter. خب میگه که یکی از در واقع پزشکا یا استادایی که تو اون بیمارستان کار میکرده توسط یه مدیکال استودنت نیدل استیک میشه و یه مدت بعدش میمیره. Semmelweis participated in the autopsy of his colleague and noted that the pathology was identical to that of women dying from puerperal fever. چقدر جالب خدایی. Although the germ theory of disease wasn't accepted yet, and Semmelweis could not have known that it was streptococcal bacteria that were doing the dirty work, he concluded that cadaveric particles of some sort were being transformed on the medical student's hand from the autopsy room to the maternity ward. In May 1847, Semmelweis introduced his students to wash their hands with carbolic acid upon entry to the ward. The mortality rate in the first clinic immediately plunged to that of the second clinic. In the annals of medicine, this episode has gone down as one of the first successful patient safety interventions. Semmelweis measured the problem, instituted a change, and measured the result. It had the potential to save untold numbers of lives. However, the Semmelweis tale is a cautionary one about implementation. You might have the best patient safety intervention in the world, and arguably Semmelweis did, but if you don't implement it well, it's a lost cause. Semmelweis faced resistance from the medical establishment, as anyone who disrupts the accepted order likely would. The senior Viennese doctors took umbrage that this Hungarian transplant Jewish noblesse was insinuating that their esteemed medical care was actually causing the death of their patients. خب طبیعتا وقتی این قضیه مشخص شد به معنی این بودش که تا الان مدیکال کیر داشته با خاطر یه خطایی باعث مرگ بیمارا میشد. خب خیلی سنگین آمد واسه Viennese doctors. Shifting an accepted mindset is a tall order, but it's a necessary one if you want to make any change. This requires finding the sweet spot between persuading, convincing, encouraging, and pressuring. Semmelweis evidently possessed none of these skills. یعنی Semmelweis هیچ کدوم این کار رو نکرد در اینکه نظرش رو جا بندازه. For starters, he didn't publish his findings for more than a decade, so no other doctors could examine his data. He insisted that they take his word for it, which irritated them even more. By all accounts, Semmelweis was abrasive and arrogant. He took critics personally, responding to his colleagues' skepticism with public hectoring and insults. To one doctor he wrote, "You, Herr Professor, have been a partner in this massacre." یعنی خب Semmelweis هم عصبی شده و به جای اینکه مثلا در این مرحله اطلاعاتش رو پابلیک کنه که بقیه هم روش چیز انجام بدن، رو حرف خودش با عصبانیت مونده. Beyond the personal acrimony, there was a system issues. If doctors had to wash their hands before examining patient, then there had to be sinks everywhere. The hospital plumbing system would have to be completely re-engineered, a hurdle that was not easily surmounted. Semmelweis finally published a book about puerperal fever some 15 years after his initial experiment. His book was poorly received by a medical community, still convinced that disease was caused by deleterious miasmas in the air. Ultimately, the establishment tried and ignored Semmelweis and his ideas. Semmelweis' mental condition thereafter rapidly deteriorated. It's not clear if he had Alzheimer's disease, bipolar disorder, or neurosyphilis, but there's no doubt that his condition was exacerbated by excessive stress along with excessive alcohol. He spent the remaining 4 years of his life bitterly lashing out at the medical establishment, sending furious and insulting letters to his colleagues. He was committed to an insane asylum in 1865 and was dead within 2 weeks. خب این نشون در اینه که خشم چقدر بده دیگه، آدم باید منطقی فکر کنه حتی وقتی بهش حمله میشه. The supreme and painful irony was that although Semmelweis was ill when he arrived at the asylum, his death was almost surely hastened by the medical care he was given. When he tried to escape the asylum, he was severely beaten by guards, straitjacketed, and placed in isolation. Standard psychiatric treatment at the time included ice bath, purging, blistering, and bloodletting. خب در واقع میخواستن که فرد خونریزی کنه که در واقع سودای کثیف از بدنش دفع شه، استفراغ مینداختنش، پرجینگ و آیس بث. By some accounts the beating caused a wound on his hand that became infected and gangrenous in the poor condition of the asylum. Semmelweis likely died of sepsis in the same manner as his patients in Vienna's first clinic. این دیگه تقریبا جزو غم‌انگیزترین داستان‌های پزشکیه و میدونیم که زملوایس رو مجسمه‌اش رو توی دانشگاه تهران هم گذاشتن حتی. The Semmelweis affair is a case study in the critical importance of implementation when it comes to engineering patient safety. But there are other lessons to be learned from this, not least of which is to pay attention to what the nurses are doing. Just as the first clinic was enjoying its first few years of lower mortality rates by emulating the midwives, a young Florence Nightingale was visiting hospitals throughout Europe and taking furious notes on their mostly horrific conditions. She noted that many medical treatments, which included arsenic, mercury, and rampant bloodletting, inflicted more harm than good. Like Semmelweis, she quickly learned that doctors do not want to hear that their well-honed treatment are wrong, harmful, or both. During the Crimean War, the Nightingale این اسم فامیلش چیه؟ فلورنس نایتینگل دیگه، این که خیلی معروفه. During the Crimean War, Nightingale worked in British Army Hospital in the Scutari region of the Ottoman Empire, and she was appalled by the abysmal conditions. At least 4 times as many soldiers died of disease as on the battlefield, numbers that came to light only because of Nightingale's meticulous record keeping. She set rigorous standards for hygiene, including hand washing, wound care, food preparation, medical supplies, and patient triage. Over the course of 1855, the mortality rate in the hospital dropped sharply from 33% to 2%. میگه قبلش در واقع بیماری عفونی توی جنگ بیشتر از خود جنگ آدم میکشته. وا چجوری شد؟ خب میگه in her 1863 book Notes on Hospitals, she wrote with a rather modern style of pithy irony, it may seem a strange principle to enunciate as the very first requirement in a hospital that it should do the sick no harm. It's quite necessary nevertheless to lay down such a principle. Nightingale's book preceded the IOM's To Err is Human by 136 years, but the gist of the message was similar. Medical care can actually be dangerous for patients, and one must focus on fixing the system in order to improve overall health and safety. Nightingale was a bit more canny in her implementation approach than Semmelweis. She hand-delivered a copy of her book to Queen Victoria. As any modern-day patient safety advocate can tell you, it always helps to go straight to the top brass. خب این میگه که کاری کرد که در واقع بقیه نتونن اذیتش کنن اینه که کتابشو به ملکه ویکتوریا داد. در نتیجه ملکه ویکتوریا آبشارتش فاندش دیگه کسی نمیتونه چپ بهش نگاه کنه. There was pushback from the establishment. Of course, Nightingale's experience was eerily similar to Peter Pronovost's a century and a half later with catheter-related infections. The medical profession had trouble accepting the idea that these bad outcomes were preventable, just as it was accepted wisdom that catheter-related infections simply came with the territory, so were deaths in military hospitals considered part of a parcel of war. یعنی در واقع هم مشکلی که داره اینه که خیلی ذاتگران افراد دیگه وقتی نمیخوان تغییر کنن میگن که خلاص جنگ دیگه، توی جنگ یه سری مثلا زخمی میشن میمیرن و هیچکی نمیخواستش توجه کنه که خب آقا چرا میمیرن، اگر به خاطر مثلا عفونت چنان که مشخص شد بیان یه کاری براش بکنن. Nightingale noted with angry resignation that the sound principles of hygiene are by no means widely spread, because people continue to accept contagion as an unavoidable cause of death. The idea that how we care of patients can cause harm was just as threatening to the medical establishment in the 1850s as it was in the early 2000s. Nightingale also demonstrated with just as much resistance the same point that Pronovost had to argue, that you have to measure what's going on in order to know where, how, and if you can make progress. The military bureaucracy was apoplectic with frustration at Nightingale's insistence on detained record keeping, but she persevered. Many credit her with laying the foundation for modern day infection control. خب میگه که اون موقع در واقع سیستم نظامی دوست نداشتش که خانم فلورنس نایتینگیل مدیکال ریکورد برداره، ولی به هر حال اون کارش انجام داد. It's almost ironic that all 5 steps in Pronovost's checklist are present in Nightingale's own formula for improving patient care. He used the word sterile where she used the word clean, but otherwise her rules are essentially the same. Wash hand, clean the patient's skin, use clean coverage for the patient, use clean clothing for the staff, cover the wound with clean dressing. From rigorous documentation and scrupulous clinical technique to a focus on systems improvement and implementation, it's no wonder Pronovost became so convinced of the need to empower nurses in order to tackle patient safety. Pronovost described to me how enlightened he considered himself at the beginning of his career. I'll be a team player and I'll ask the nurses for their input. He would told himself, congratulating himself on this progressive attitude. He sort of did, but it was really only lip service. He didn't actually listen to what they had to say. As he became more steeped in the culture of patient safety, he then decided to ask nurses to join doctors on rounds because this would emphasize that medical care was a team effort, but the ICU was a busy place and it was often hard to coordinate if the nurses weren't available at the time of rounds. It didn't make sense to delay everything, so he would go on without them. میگه که در واقع تصمیمش این بود این کار بکنه، ولی فقط تبدیل شد به یه حرف، به خاطر اینکه در عمل اتفاق نیفتاد، حالا به خاطر یه سری دلیل مثل شلوغ بودن ICU و غیره. Now he told me if the nurses aren't available, I won't do rounds at all. Collaboration, he realized, wasn't just a politically correct buzzword, it was actually one of the most important pillars of patient safety. Staff members from different disciplines and different ranks needed to be able to work together and talk openly. They had to be able to point out problems and errors without fear of being reprimanded or belittled. If an institution is going to truly recognize the high-risk nature of medicine and commit to improve patient safety, it had to create an environment that fosters real collaboration, This requires a commitment of resources. You need to have adequate time, space, and staff. Overstretched staff who can barely keep their heads above water won't have much bandwidth for collaboration. It also requires a commitment of attitude, setting the example from the top, that criticism is encouraged, that scapegoating won't be tolerated, that hierarchy and egos won't rule the day. اینم که حرفای خیلی قشنگیه. Patient safety and avoidance of medical error is a complex mix of how individual medical professionals interact and communicate with one another, how they do so with patient and family members, and how state-of-the-art medical system can nevertheless allow small things to fall through the cracks. Human psychology plays as potent a role in the success or failure of medical care as the most advanced technologies. There's also a thread that carries forward from the stories of Semmelweis, Nightingale, and Pronovost. Pay attention to the nurses. This is something that plays out potential in the story of GA. حالا میخواد داستان GA رو بگه. A sea of uncertainty. Not every naval aviator is game enough to give it a go at the hula hoop, but Jay did not intimidate easily. Facing off against the V-Fit hula hoop game, there was the lieutenant commander in nothing but his boxers, gyrating his hips like a belly dancer in the family basement on a Friday morning in late May. As a naval reservant who flew in E-2C Hawkeye turboprops, Jay had to pass a grueling fitness test every 6 months, so he was always sniffing out creative ways to stay in shape. What could be better on a warm spring morning than hula hooping in your ski whiz? فقط یه کوتاه بگم که هولا هوپ این چیز دایره قلیاس دیگه، برای اینکه آدم رو شیپ بمونه از این کارا داشته میکرده. A lean 6-footer who didn't smoke, drink or get sick, Jay was a relentless straight arrow. At 39, he was in a good physical shape as when he'd graduated from the Naval Academy. His day job was as a bank manager and he dressed the part even on weekends, but he had an easy laugh and an even easier smile. The hula hoop, though, is not for the faint of heart, especially without proper gear. On Saturday morning, Jay was feeling its effects. My nuts are sore, he confided to his wife, Tara, confessing his boxer shorts fox pass. She told him to call his doctor, but he shrugged it off. As an experienced ER nurse, Tara had handled many a weekend warrior with pulled groin muscles. She rattled off the basic treatment: jockstrap, ice pack, ibuprofen, and lay off the hula hoop for a few days. این هم میگه که داشته که از این هولا هوپ کار میکرده دچار درد تستیس میشه و به همسرش میگه و در واقع همسرش هم میگه که به دکتر زنگ بزن، ولی اون نمیکنه. همسرم که خب یک رجیسترد نرس بوده و با در واقع تجربه هم بوده، میگه احتمالاً کشیدگی کشاله رانه، براش آیس پک و ایبوپروفن و اینجور چیزا میذاره. Tara had an ER shift the next day, and so she tiptoed out of the house while Jay and the kids were still sleeping. But around 9:30 on that Sunday morning, Jay called Tara and said his pain was now 8 out of 10 and he was nauseated. Tara told him to get to the hospital as soon as possible for an ultrasound because these could be signs of testicular torsion, a certifiable emergency. If a testis is not surgically untwisted, it can die from lack of oxygen. This time Jay complied. In the emergency room, however, the ultrasound showed no torsion. A slew of routine labs clocked in normal with the exception of a slightly low white blood cell count. The pain was chalked up to a overly exuberant exercise and the lieutenant commander was sent home with ibuprofen and ice pack. میگه اولتراساندم کردن شواهد تورشن نبود و فقط وایت بی سی کم داشتش. گفتن که احتمالا این درد به خاطر همون ورزشی بوده که کردی و با ایبوبروفن و آیس پک مرخصش کردن. White blood cells serve as the public face of the body's immune system. The various subtypes of white cells, neutrophils, lymphocyte, monocyte, basophil, eosinophil, each have a specialized role in protecting the body against bacteria, viruses, parasites, cancer, and allergens. The white count, as it's usually referred to, is typically elevated when there is an infection, but some infections can lower the white count. When Jay's urine culture was E. coli urinary infection seemed a reasonable explanation. Jay was given 10 days of ciprofloxacin and antibiotic with a plan to repeat the white cell when the course of treatment was completed. After a day or two sitting on ice pack, Jay's growing pain resolved and he was back at work at the bank. The repeat lab though showed an even lower white count. Within a few days, Jay and Tara were sitting in a hematologist's office puzzling over the results. And it was a puzzle, as Dr. Selvin pointed out. Jay was squeaky clean healthy. He had no fever, weight loss, or swollen lymph nodes. He had no rashes or joint pains. He hadn't traveled recently to an exotic location or received a blood transfusion or gotten a tattoo from a CD parlor or taken strange herbal remedies purchased off the internet. He was just a little bit tired, and when you are raising two teenagers, working long hours in a bank and keeping up as a naval reservist on the side, well, you'd be expected to be a little tired. The clinical picture did not fit the profile of serious illness such as leukemia or HIV that can present with a very low white count. Statistically speaking, the low white blood cell count was most likely due to an ordinary viral syndrome. The other possibility was a condition called cyclic neutropenia, in which the white cells critically drop, likely from a genetic disorder. In either case, the hematologist thought it would make sense to give Jay a dose of filgrastim, a bone marrow stimulant, just to get his white count out of the danger zone. But this didn't feel right to Tara. Jay had always been perfectly healthy and he didn't really have any symptoms of a viral syndrome. The urinary infection had been fully treated. Why should his white count be low? She asked Dr. Selvin to do a bone marrow biopsy to figure out what was going on inside. Dr. Selvin hesitated. A bone marrow biopsy involves inserting an intimidatingly large needle into the hip bone to extract a sample of the marrow and inner bone. The bone marrow is the hive where the blood cells of the body develop, so a biopsy permits doctor to examine the immature forms of the blood cells. They can see if the cells appear aberrant as they do in cancers such as leukemia or lymphoma. They can also see if the bone marrow has stopped producing blood cells altogether, which can occur as a result of infection, medication, toxin, radiation, genetic abnormalities, autoimmune disorder, or certain vitamin deficiencies. So when it comes to figuring out why blood cells aren't behaving as they should, the bone marrow is where the money is. But it's not a minor procedure. When I was a resident at Bellevue Hospital at the height of the AIDS epidemic, our wards were filled to the gills with a feverish patient who had abnormal blood counts and needed bone marrow biopsies way more than the overworked hematology flow could possibly keep up with. Waiting around for the fellow to be available drove me crazy. Besides delaying care for my patients, it delayed discharges, it kept my patient load high. So the only practical recourse I decided was to just learn to do it myself. I tagged along with the kindly but exhausted hematology flow for a week. There were so many bone marrow biopsies to do that I quickly got enough procedures under my belt to start doing them for my own patients. Of course, when word got out that I was certified in bone marrow biopsies, I was soon doing them for everyone's patients. I began stocking the biopsy kits in my locker underneath my supply of granola bars so that I wouldn't have to keep running down to central supply each time I needed one. The thing that struck me most about the bone marrow biopsy was how physical a procedure it was. Most medical procedures I've done to that point, spinal taps, arterial lines, central venous catheters, removing fluids from swollen abdomens or lungs, were delicate transactions that required a deft and careful touch. A bone marrow biopsy on the other hand required brute force. خب این راست میگه خیلی زور زیادی میخواد که در واقع استخون رو بتونی سوراخ کنی برسی توش، اونم استخوان هیپ رو. A 6-inch needle the width of ballpoint pen is pressed through the patient's skin and soft tissue into the hip bone. Local anesthesia is used of course, but the needle needs to be forced corkscrew-like deep into the bone. It's like twisting a wine bottle opener into granite. You have to bear down and twist with real muscle to get that needle several centimeters into the hip bone. Through only the outer layer of bone, the periostome possesses nerve receptors and can detect pain, but the intense pressure of a doctor grinding deep into the bone is not lost on the patient or the doctor. So I understood why Jay's hematologist didn't jump to a bone marrow biopsy willy-nilly. It's an invasive and painful procedure with risk of infection and bleeding, so should be done only with careful thought. Dr. Selvin said he didn't think Jay needed one, or at least didn't need one yet. Jay didn't have any symptom of a malignancy or severe infection, such as fever, weight loss, swollen lymph node. Besides, Dr. Selvin pointed out, what happens if I do the bone marrow biopsy and then it turns out not to be covered by your insurance? You could be stuck with a $5,000 bill. Tara could see that Dr. Selvin was thinking about the whole patient, not just his narrow sliver of expertise, and she appreciated that. She'd seen him at work in the hospital. He was conscientious and thorough, but she just wasn't comfortable with the low white count. She pressed him to do the bone marrow biopsy. Dr. Selvin's preference was to give the Rust team a chance before deciding whether Jay truly needed a biopsy, but he'd also seen Tara's clinical instincts and her willingness to go the extra mile for his patients. Okay, he finally said, for you, I'll do it. When the diagnosis came back as AML, Dr. Selvin was as shocked as anyone. Acute myeloid leukemia is a cancer of the white blood cells, and as its name suggests, it usually presents acutely. Patients with AML suffer raging fever, drenching sweats, and grinding fatigue and bleeding gums. که هیچ کدوم این علامت ها رو این حاجیمون نداشته. They can present a leukemic crisis in which floods of cancer cells unleash hemorrhage, blood clots, overwhelming infection, respiratory distress, kidney failure, and heart attack and stroke. پس میگه که ممکنه یه وقتی توی ما لوکمیک کرایسیس اصلا تشخیص AML و اینا برسیم که وقت اکیوت باشه که لوکمیک کرایسیس هم این کامپوننت ها رو داره. Most patients newly diagnosed with AML are not capable of standing with crisp military posture or piloting airplanes or doing the hula hoop. I can't believe it myself, Dr. Selvin said. The Brownian motion of life has a way of knocking seemingly irreconcilable events up against each other. And so it was the 24 hours after AML had matched into their lives. Jay and Tara were seated amid a picturesque field of wildflowers, posing for a photographer with their two children. Tara had arranged his family portrait months earlier because 15 years old Sasha was setting off in 2 days for a once-in-lifetime trip to China. Sasha had been studying Mandarin in earnest, and she was now embarking on a month-long language immersion program. With raw and ragged emotions, Jay and Tara perched on a quaint stone bench while Sasha and 30-year-old Chris goofed around behind them, mugging for the camera. Tara and Jay had made the difficult decision to not tell their children about the diagnosis just yet. They wanted Sasha to enjoy her long-planned trip with an unburdened heart. Jay and Tara gripped hands tightly during the photo shoot and leaned their hands together, his dark brown hair against her red, while their children teased each other and cracked jokes. We bolstered the weight of the world on our shoulders, Tara recalled, to shield our children from this painful reality. The portrait shows a beautiful, smiling family surrounded by a profusion of pink and purple flowers with an old wooden fence sagging comfortably nearby. 2 days later, they saw Sasha off at the airport, holding their own emotions painfully in check. Tara and Jay hugged their daughter and sent her off on her long-anticipated adventure. The hospital where Dr. Selvin and Tara worked did not have a specialized unit for leukemia, so Jay was referred to a big city cancer center, and that's where Jay and Tara found themselves shortly after they bid farewell to Sasha. For this initial consultation, they were encouraged to bring family members, so the conference room was packed with Tara's and Jay's siblings, parents, and brothers and sisters-in-law, all seated around a richly textured oak table. Tall and good-natured Dr. Everett took the time to get introduced to everyone in the sprawling family and genially tolerated everyone's eccentricities. But he was also blunt. He wanted to admit Jay to the hospital right away as soon as the meeting ended, in fact, to begin chemotherapy. Jay's robust health and lack of classic AML symptoms were good news, Dr. Everett said. The fact that Jay's labs, other than the low white counts, were all normal was also good news. The fact that he hadn't experienced any infections or bleeding was more good news. All of these factors improved his odds. A true prognosis could not be entertained, of course, until the specific subtype of AML was known, but that wasn't any reason to delay the start of treatment. AML is actually a conglomerate of subtypes, some that are known to be curable and others that carry graver prognosis. Although Jay's subtype wasn't known yet, an otherwise healthy person like him was the kind of patient for whom a cure was possible, even probable. Jay would ultimately require a bone marrow transplant, but doctors could fashion it from his own cells, an autologous transplant. They would harvest some of Jay's cells and protect them, while the rest of his bone marrow was ablated by chemotherapy. When things settled down, they would give Jay back his own cells to populate his bone marrow. There are always potential bumps along the way when it comes to removing, ablating, and restoring someone's immune system, but it was all eminently doable given the possibility of a full cure. Chemotherapy should be started now, today. But there was a hitch, a uniquely American hitch. The kind of hitch that occurs only in places where the fine print of insurance policies can end up directing medical care. Jay had been at his current job for 51 weeks, a week shy of the 1 year mark that he needed in order to qualify for short-term disability. If they started the chemotherapy now, he would be rendered ineligible for disability payment. خب میگه به جای 52 هفته 51 هفته سر کار رفته بود فعلا و در نتیجه disability payment نمیتونست بگیره. When Jay had first been told of the AML diagnosis by Dr. Selvin a week earlier, tears ran down his face. The first question he'd asked the doctor in a quivering voice was, "What will happen to my kids?" And that question was still at the forefront of his mind. He and Tara knew that the treatment was not going to be easy physically, mentally, or financially. As it was, Jay and Tara were still recovering from Jay's job layoff a year earlier. They would reluctantly uprooted their children from the only home they would ever known and driven 15 hours to relocate near a new job and grandparents. At the time of the AML diagnosis, they were still living with Tara's parents trying to save money to buy a house. Even the health insurance, a major illness, could drain their saving. میگه حتی اگه هلش اینشورنس هم با اینکه داشتن ولی سیوینگشون میتونن. And who knew what Jay would feel like at the end of his treatment and whether he would be able to return to his job at the same level. Tara was putting in 50 to 65 hours per week in the ER, but even that might not be enough to support a family of 4. Jay could be out of work for months, maybe even a year. Disability payment might be critical to their survival. The uncertainties of his health were agonizing enough. Jay didn't want to risk giving his family an additional hardship if there was a way to provide some sort of financial cushion, all on account of 7 days. So Jay asked his new hematologist if they could delay the start of treatment by 1 week. Dr. Everett hesitated. In the scheme of things, given the months and years it takes for cancer to develop biologically, 7 days probably wouldn't make a difference. But once you are in the ring, as it were, you never want to give cancer even the slightest edge. But then again, you also don't want to pull the financial rug out from under a family about to embark on one of the most wrenching, frightening journeys imaginable. And how awful to put the patient in a horrific position of choosing between his health and his family's financial well-being. As a physician, you want your patient to be in an emotionally strong position before embarking on a treatment course like this. Chemotherapy is a bulldozer, and it's not just the patient who feels the effects. Luckily, all of Jay's good prognostic factors, young age, excellent health, lack of symptoms, were buffer. The AML hadn't exploded yet, and there was no sign that it was imminent. Clinically, there wasn't any good reason that they couldn't wait 7 days. This would be highly unusual, Dr. Everett said, but he agreed to postpone the first treatment, induction chemotherapy, for a week. Game on. Jay wrote on July 1 in the blog he would begin keeping for his family and close friends. Well, all we know right now is that it's AML, a type of leukemia. I will be tested tomorrow, bone marrow again, to determine if I have APML. This would be the best type of AML to have. The doctor don't think it's this one, but I can keep my fingers crossed. Either way, I will probably start my first round of chemo next Wednesday. July 1, coincidentally, is also game on for all the new interns, residents, and fellows in the hospital. It's the first day of the new medical year. So everyone is ratcheted up a notch on July 1. I'll talk about the so-called July effect, if there actually is one, later on in this book. The calendar coincides did not go unnoticed by Tara. She was always vigilant as a nurse, but she was extra vigilant in July. Jay called the benefits office at his job and verified that he would qualify for disability on July 8. The family health insurance was Tara's job, so she would need to keep working in the ER during his treatment. While waiting for July 8 to arrive, Jay did the repeat bone marrow biopsy for the subtype testing. Well, it was a fun field day today, Jay wrote in his blog. They drilled into my hip again for bone marrow. We will get the test back on Tuesday, but that is the fun part. He also learned his tolerance or lack thereof for drugs. I am truly a lightweight, he wrote. He would been given some moderate level pain medication before the procedure, and when it was all done, he promptly passed out in the elevator on his way home. After some fluid and monitoring, he was sent on his way. He quipped on his blog that he would make a lousy drug dealer. Induction chemotherapy is the most powerful round of chemotherapy intended to obliterate the cancerous cells as forcefully and definitely as possible. Despite all of our medical advances, however, chemotherapy is still a crude instrument. It drops like an anvil on rapidly dividing cells, the sine qua non of cancerous cells, but in its wake will mow down all other rapidly dividing cells in the body, such as bone marrow cells, hair cells, and the cells that line the mouth, stomach, and entire GI tract. Hence, the cardinal side effects of chemotherapy: nausea, vomiting, mouth ulcers, hair loss, plus decimation of red blood cells, platelet, and healthy white cells. Loss of these cells leads to anemia, bleeding, and infections. As such, induction chemotherapy is usually done as inpatient treatment so that the patient can be monitored closely for these potential deadly side effects. Subsequent rounds of chemotherapy with milder doses can often be done on an outpatient basis. Jay and Tara waited nervously through the first week in July, but endeavored to keep the home routine normal. They sat down with 30-year-old Chris and told him about Jay's diagnosis. They explained that Daddy would be 13 years ساله. They explained that Daddy would be very sick for the next few weeks, but that he would be getting good medical care from his doctors and nurses. They explained that they would tell Sasha about it when she got home from her trip in China. They kept things as calm and low-key as possible. As it happened, Chris had a week-long sleepaway camp coming up. Jay and Tara agreed that it would be good for him to be with his friends and not to witness the harsh first round of chemotherapy. They helped him pack and kept up their smiles as they saw him off on the bus. The day before Jay's admission to the hospital for induction chemo, the extended family gathered to help him shave his head. Tara's 5 siblings plus a spouse and parents assembled under the majestic maple tree in her parents' front yard. It was light-hearted and wrenching all at the same time. Tara's father sang in Italian like a barber as he tried to give Jay a buzz cut. The clippers jammed in the middle of his area and they had to dig out regular scissors. خب بازکاتم که جایی هستش که مو یه دست کوتاه میشه، مثلا توی جاهای نظامی و اینجور جاها، و اولش که منوال هیر کلیپر ها اومدن، در واقع این حالتی که یه دست از مثل صفر بزنیم کله رو پاپولار شدن. The clippers jammed in the middle of his area and they had to dig out regular scissors. The crew of barbers was ridiculously inexperienced and the process took more than 1 hour. Jay, who had been through the head shaving routine multiple times in the military, tolerated his motley groomers good naturedly. Between the goofiness and jokes, though, each family member was overcome with tears at some point and quietly excused him or herself to weep in a distant part of the yard. Tara's sister snapped a photo of Jay just before the shaving ceremony began. Jay's eyes crinkle at the corner and he almost looks mischievous. There was no fear apparent in his 200-watt smile. But hours later, at 1 in the morning, he rolled his face into Tara's chest, sobbing. "I'm scared," he told her. His body was shaking, and all Tara could do was reassure him that he wouldn't be alone. She caressed the smooth skin of his head, holding her own fears inside so as not to worsen his anxiety. Jay finally drifted off while Tara remained awake, trying to wrestle away her fears. The next morning, July 8, Tara and Jay drove an hour to the cancer center for the induction chemotherapy. "This place will become my second home for the next 2 years," Tara remembered thinking. For a facility with such a high reputation, it was shabbier than she would expected. The ceiling tiles were stained, the walls dented, and the flooring reminiscent of the 1950s. But Tara had worked in enough hospitals to know that externalities ultimately had no bearing on quality. She would work with fantastic medical staff in the unfanciest of settings. Coming in a patient, though, made you see things a little differently. A little window dressing wouldn't have hurt. The games begin. Jay had written in his blog the night before, and begin they did. Jay was whisked straight to the interventional radiology suite to get an indwelling catheter implanted in his chest. This would stay semi-permanently for the duration of his chemotherapy, minimizing the need for doses of needle sticks and IVs. Tara watched with relief when Jay was wheeled back on a stretcher, deep in conversation with the burly orderly, asking the orderly how many children he had and how old they were. The site of the catheter placement was sore, and the pain worsened over the course of the afternoon. "They gave me some pain meds," Jay wrote lately that day, "and guess who passed out again? Now the most they will give me is Tylenol." Once the catheter was placed, Jay was ready to start the chemo, but when Dr. Everett arrived, there was bad news. The final results of Jay's bone marrow biopsies showed a mutation known as trisomy 11, a rarer and nastier form of AML. Dr. Everett, who had seemed so jovial and upbeat at their initial meeting, was all busyness now as he related this grimmer news. Chemotherapy would still start today, but he would rejigger the components to take this new information into account, and Jay would not be able to use his own bone marrow for a transplant. They would need to turn to the family for donors. The week of the induction chemotherapy was brutal. All the textbook side effects showed up like clockwork: nausea, vomiting, mouth sores, plummeting blood counts. Tara ran back and forth between Jay's hospital and hers, keeping up as many ER shifts as she could. Her 5 siblings and their spouses and their in-law tag teamed with Jay's work colleagues and Tara's parents so that Jay was never alone during this rough week. "Thank you for the inspirational notes and the visits," Jay wrote in the blog. "It's nice to have people come and go and just watch a movie. Plus, in my new condition, I ask much more personal questions since what do I have to lose? I have cancer. You have to answer me now." The thing Jay feared most was being helpless. He was determined not to turn into one of those hollow-eyed patients he would see in movies, who could barely muster the energy to sip ginger ale through a bendy straw. So no matter how rotten he felt, every few hours he locked his ivy pole and made his rounds of the floor. Tara joked that it was like he was running for office, the way he greeted each and every person he passed each and every time. "Feeling pretty good right now," Jay wrote several days into the chemo. think I have the right mix of nausea and chemo drugs going on. Tara and I are about to start my evening walk, going to do about 1.25 miles. Jay was on the BMTU, the bone marrow transplant unit, even though he wasn't yet getting a bone marrow transplant. The BMTU was the central location for all hematology patients with leukemia. Dr. Chowdhury, the hemo-oncology flow, was in charge of Jay's day-to-day care in the BMTU. Tara recalled that Dr. Chowdhury spent more quality time in Jay's room than anyone else, even more time than the nurses. High praise indeed coming from a nurse. For Jay and Tara, Dr. Chowdhury's presence was instantly calming and reassuring. Her unhurried style, her willingness to answer every question, and her genuine caring were a lifeline during those stressful days. Dr. Everett was the attending, guiding Jay's overall treatment, but Dr. Chowdhury was the boots on the ground doc who was on the BMTU all day, every day. I hope you are all doing as well as I am, Lord Jay wrote midway through the chemo. My chin is up. The tough days will be coming and I'm ready for the fun. Lips won't be good and neither will the end where the sun don't shine, but I know I can handle it. 2 days later, Jay wrote, well, I must really be settling into a schedule now. I woke up at 5:30, shaved, then went for my 30 lap walk along with some V-Fit exercises. It feels good to tire my legs and abs a bit, makes me feel alive. Feeling good but not tasting so good. The chemo taste in my mouth is a bit much right now, but I will trade bad taste and day I can exercise. Any day I can exercise. On July 13, one last day of chemo, Tara arrived in the evening after her shift. It had been a long day and she soon fell asleep on the couch in Jay's room. She awoke at 3 a.m. and her eyes, per usual, went right to Jay. She sprang off the couch when she realized that Jay's bed was empty. She found him in the bathroom, struggling to untwist his tangled ivy lines. As she reached to help with the IVs, she noticed a strange look on his face. His skin was pale and sweaty, and before she could even say anything, he began to have a seizure. Tara caught his body as he collapsed, but they both tumbled to the floor. Every hospital bathroom has a call motion button, but Tara, pinned beneath her 6-foot husband, couldn't reach it. She screamed for help, but the bathroom door was closed and Jay's room was more than 30 yards from the nurse's station. Tara struggled to extricate herself from her husband's shuddering body, shimmying and crawling until she could just reach the call button. A nurse came quickly, and her immediate call for help brought in a pause of other nurses, plus the overnight home oncology flow Dr. Amir. Tara recalled being surprised that nobody wheeled in a code card on oxygen, but they did perform an EKG, which showed a very low heart rate, 30 beats per minute. The working explanation was that the slow heart rate caused syncope, fainting, which in turn caused the seizure. The next day, both a cardiologist and a neurologist came to see Jay. A CT scan of the head and a tilt table test to evaluate causes of fainting were negative, and both doctors cleared Jay. Dr. Everett was away, but the covering hematologist was in agreement that all of this was a side effect of chemo, and the next day Joe was discharged home. Tara argued that should this happen again at home, Jay could easily fall and smash his head. She thought Jay should stay at least another day in the hospital, but the covering hematologist felt that the risk of infection, should Jay stay longer in the hospital, far outweighed the risk of falling. The first day at home were relatively uneventful. Jay had an armada of anti-everything to take: antifungals, antivirals, antiemetics, antacids, and of course antibiotics. Now that the chemotherapy had rolled tank-like over his immune system, he was a sitting duck for infection. Home was less dangerous than the hospital in the regard, but it was still a risk. Every hiccup, every dust mite, every smudge could harbor a potential deadly pathogen. The medications were an attempt to weave a web of protection, but no web is ever solid. Jay and Tara had to check his temperature round the clock, remaining vigilant for even the slightest fever, with instruction to return to the hospital immediately when the thermometer hits 100.4 degrees. It's not a matter of if, said his doctor, but when you get a fever. اگه حتما فیور رو میگیرید، حالا فقط بستگی داره کی باشه، هر موقع بود سریع بیاید. Up again in the middle of the night, Jay wrote at 4 a.m. on his second night at home, "Don't feel bad for me, as I'm still at home, which is awesome. More choices on TV and the internet is better. I'm really feeling weak due to my low blood counts and had to pass on a shower today. Tara was nice enough to get me cleaned up. Wow, a great wife and a nurse. I highly recommend sponge baths, but not if you need to get leukemia to get one." شوخی با مزه. 2 days later, Jay was feeling stronger, so Tara helped him take a much needed and much desired shower. They were easing into the shower stall when suddenly Jay began to wobble and his eyes rolled back in his head. Tara braced herself to catch him. As he started to lose consciousness, he landed with a thud against her. She was able to guide him down to the floor slowly, but was once again pinned beneath him. She yelled for her mother to come help, but when she turned her head, she saw that it was their son standing in the doorway. Tara forced her waist to calm down. "It will all be okay, Chris. Dad is okay, but I just need Grandma's help now. Please get her now." When Tara's mother arrived in the bathroom, they laid Jay flat and elevated her legs. Jay regained consciousness quickly and was devastated that his son had to witness this. His first words were, "Please go take care of Chris." That night, Chris parked himself near the couch where his father slept. He set out his sleeping bag just a few inches from where Tara was bedding down on the floor and spent the night there. Tara was heartbroken to see how much the episode in the shower had rattled her son. It rattled her too. This was now Jay's third episode of syncope. Tara was less concerned about the cause of the loss of consciousness. He would already had a full evaluation from a cardiologist and neurologist in the hospital than that it could happen at a random time. With his platelet counts decimated by the chemo, the bleeding could be unstoppable. Tara had helped so many patients and families deal with illness, but this was the first time she herself had descended into the existential panic that comes with serious disease. There was nothing that could offer a bedrock of certainty, not her nursing experience, not the hematology textbook she would checked out of the medical library, not the skills or qualifications of Jay's doctors, nothing. The terrifying truth is that when you or a family member gets sick, no matter how many friends and family are there for you, no matter how superb the medical team is, you are still alone in a sea of uncertainty. شد. خب چون این فصل تموم میشه من اینجا قطع میکنم ریکورد رو، ادامهش رو توی ویدیوی بعدی میگم. ممنون اگر این ویدیو رو تا اینجا دیدین. فعلا خدا نگهدار.